Kogi State Governor Ahmed Usman Ododo has launched a program to provide free malaria testing and treatment in government hospitals across the state. Governor Ododo reiterated his commitment to ensuring the healthcare services are accessible and equitable for all citizens of Kogi State. The governor made the recommendation during the launch in Government House, Lokoja. Ododo commended the Ministry of Health and Development partners for their dedication to advancing healthcare development in the state. Our reporter tells us more.
According to the governor, the free malaria test and treatment is an initiative aimed at improving healthcare services and reducing the burden among the people. He highlighted the importance of Kogi State Ministry of Health's efforts to enhance healthcare services. Governor Ododo reiterated his commitment to ensuring that health services are accessible and equitable for all citizens in the state. He commended the development partner for their dedication to advancing healthcare development in the state.
Community leaders, religious leaders, health professionals, and every one of us here today must play a role in ensuring that our people stop being at mercy of malaria. Since the start of my administration, we have prioritized health sector as a key pillar of our development agenda, ensuring our people have access to equitable and quality healthcare services. The importance of healthcare is great. Without healthcare, society cannot function properly and optimally. Today, we take a significant step forward. With support from the Islamic Development Bank, the Kogi State government is distributing about 15 trailers loads of anti-malaria drugs and rapid diagnostic test kits worth over 4 billion naira. These supplies will be distributed across 536 government healthcare facilities. This includes 2 primary healthcare centers per ward, general hospitals, cottage hospitals, Coastal Teaching Hospital in Okene, Prince Abubakar University Teaching Hospital in Nanyamba, Kogi State Specialist Hospital in Lokoja, and the Federal Teaching Hospital, Lokoja. This is an audacious attack on malaria by our administration. The supplies include over 10,000 cartons of anti-malaria drugs and test kits, with more than 1 million doses for children and nearly 2 million doses for adults. Beyond this, we are also preparing to distribute over 3 million long-lasting insecticide-tested nets across all the 21 local government areas of our state to further prevent malaria. However, no initiative can succeed without the support of our people. I call on all stakeholders, traditional rulers, religious leaders, institutions, government agencies, NGOs, youth groups, market women, civil society organizations, and non-state actors like Farmcrease Healthcare to join hands in ensuring the success of this intervention. Let us make sure these supplies reaches every corner of our destiny. I must emphasize, these drugs and test kits are for free testing and treatment. They are not for sale. We are confident that these efforts, combined with the many infrastructure projects we have initiated in the health sector, will significantly improve health outcomes in our dear state.
The Commissioner for Health, Dr. Abdulaziz Adams Adeza, highlighted the devastating impact of malaria in Nigeria, citing alarming statistics with death records.
In every 4 deaths that occur in the country, 1 is due to malaria. And it means in every hour, 23 people die in the country from malaria. This is indeed alarming. And from the research done in 2021, the survey showed that children and pregnant women are the most vulnerable group to malaria. And in Kogi State, though the prevalence of malaria amongst children 6 to 59 months is 16%, which is lower than national average of 22%. Still at that, many of our children are still dying of malaria. I'm happy today to be part of this One Health team in Kogi State, providing this yet another magnificent intervention in health of the Kogi people, which is to ensure equitable, accessible, and quality healthcare services being delivered to the people of the state.
Dr. Abdulaziz announced the launch of a new malaria treatment intervention targeting older age groups, which will complement this existing program for children.
The government of Kogi State is not relenting in efforts to attend to healthcare needs of her people. Since 2021, the government of Kogi State have been creating enabling environments for the conduct of seasonal malaria chemoprophylaxis, which has resulted in significant reduction in morbidity and mortality due to malaria amongst children under 5, which, from the survey done in 2021, the prevalence of malaria in Kogi State reduced from 24% to 16%. However, the older age groups, which I belong to and several of us have belonged to, have been waiting for malaria treatment intervention, which is targeted at us. Such intervention is here today. Due to the double-edged approach of seasonal malaria chemoprophylaxis for preventing malaria in children less than 5, which has been ongoing in the state since year 2021, and this laudable intervention as well that is targeted to our age group for free testing and treatment of malaria will together reduce the burden of malaria to us in Kogi State.
Donor agencies appreciated the cooperation they enjoy with the state government and assure of their utmost support to eradicate malaria to its barest minimum.
Our officers have been going through the nooks and crannies of the state from house to house to distribute these drugs. Last year alone, over 1 million children were reached with SMC intervention to prevent them from malaria. We cannot but appreciate Your Excellency for helping us last year to flag off the 2024 seasonal malaria prevention at the State Medical Store.
This project, the Support to Malaria Elimination Program, is designed to tackle malaria in a sustainable, data-driven, and with a community-led approach. And it is targeted to provide services in all the 21 local government areas. The project will distribute insecticide-treated nets, improve case management and access to effective treatment by ensuring timely diagnosis and care, quality of care. We provide last-mile distribution of life-saving malaria drugs and commodities, the nets and the medicines. We will conduct surveillance and make data-driven decisions. We'll do strong community engagement to change behavior and improve health-seeking behavior. And we'll work with the healthcare workers to ensure that the capacity is built to ensure that they provide quality health services.
The State Permanent Secretary of the Health Ministry, Dr. Enehi, acknowledged the devastating impact malaria in rural communities, particularly in rural areas where it remains a leading cause of mobility and mortality. She, however, noted the significant progress made in recent years in controlling and eliminating malaria, guided by the World Health Organization Global Strategy. The state government has given the marching orders to ensure promises made are fulfilled during Governor Ododo's first tenure in office. I am Faith Adike reporting for MSC TV.